Hello, seniors. I am Dr. Robert Harrison. Your brain stopped telling you when you need water after age 60. The signal that's supposed to warn you when you're dehydrated just shuts off, which means right now, at this very moment, you could be dehydrated enough to spike your blood sugar by 20 points and you wouldn't feel anything wrong. No dry mouth, no thirst, nothing. Your body is screaming for water, but your brain isn't hearing it anymore. And that's why your morning blood sugar is 175 one day and 145 the next, even though you did the exact same thing both nights. What I'm about to show you explains why your blood sugar seems to have a mind of its own, why the same meal gives you different numbers on different days, and why you wake up with high blood sugar even though you didn't eat anything for 8 hours. Because once you understand what dehydration actually does inside your blood vessels, everything suddenly makes sense. Here's what's really happening. Your blood is a river. It carries glucose, oxygen, insulin, everything your cells need to survive. When that river is full and flowing strong, glucose moves smoothly to where it needs to go. Your insulin works efficiently because it can travel freely through your bloodstream and reach your cells. But when you're dehydrated, when that river runs low, your blood thickens. It becomes sluggish, dense, and glucose that's supposed to flow easily gets stuck in traffic. It piles up in your bloodstream because it physically can't move through thick blood the way it needs to. Think about pouring honey versus pouring water. Water flows instantly, honey crawls. When your blood is properly hydrated, glucose flows like water. When you're dehydrated, it crawls like honey. And your glucose meter doesn't care why the sugar is stuck in your bloodstream. It just measures that it's there and shows you a number that makes you think you did something wrong. But here's the part that makes this especially cruel for anyone over 60. The part of your brain that's supposed to detect dehydration and make you feel thirsty, it deteriorates with age. The signal gets weaker every year. So your blood can be thickening, your glucose can be rising, your cells can be desperate for water, and your brain just doesn't send the alarm anymore. You don't feel thirsty, you don't feel dry. There's no warning, which means you can spend entire days in chronic dehydration and never know it's happening until you check your blood sugar and see numbers that don't match what you ate. Gerald is 68. Morning blood sugar completely unpredictable for 3 years. Monday 152, Tuesday 178, Wednesday 145, Thursday 183. Same routine every night. Kept detailed records for months trying to find a pattern. Nothing correlated. Then someone asked when he drinks water. From bedtime at 10 p.m. to waking at 6:30 a.m., 8 and 2 hours with nothing. Then another hour before drinking anything, nearly 10 hours total without hydration. While he slept, his body was working. Heart beating, lungs breathing, liver processing, kidneys filtering, all requiring water. Losing water through breath and skin. By morning, already dehydrated. Then waiting another hour made it worse. His liver sensed that dehydration is stress. When your liver detects stress, it releases stored glucose into your bloodstream as emergency fuel. It's trying to help you survive what it thinks is a crisis. But there's no crisis, you're just thirsty. So now you have extra glucose that didn't come from food that came from your own liver responding to dehydration. You test your blood sugar, see a high number, and have no idea where it came from. Now here's what most people get wrong when they hear this. They think, okay, I just need to drink more water. So they start chugging glasses of water throughout the day, and their blood sugar stays exactly the same. Because it's not about drinking more water. I've seen people drink a gallon of water a day and still wake up with terrible morning numbers because they're drinking it at the wrong times, at the wrong temperature, and they're missing the one critical addition that makes your cells actually absorb the water instead of just flushing it straight to your bladder. The timing matters more than the amount. The temperature changes how your blood vessels respond, and what you add to it determines whether your cells can even use it. Before I show you the exact method, you need to understand the 3 things you're doing right now that are destroying your blood sugar control, even if you're drinking what seems like plenty of water. The first mistake is trusting your thirst. You think your body will tell you when you need water. That makes perfect sense. That's how it worked your entire life. But that system is broken now. Thirst isn't an early warning anymore. It's a late-stage alarm. By the time your mouth feels dry, by the time you consciously notice you're thirsty, you've been dehydrated for hours. Your blood is already thick. Your glucose is already elevated. The damage is already done. You can't wait for thirst. You have to hydrate on a schedule whether you feel like you need it or not. The second mistake is drinking massive amounts all at once and then going hours without anything. You wake up, you're busy, you forget about water, then mid-morning you suddenly remember and gulp down a huge glass trying to catch up. Then you get busy again and don't drink anything until afternoon. Your digestive system can only absorb about 1 cup of water every 15 minutes. Anything more than that just runs straight through to your bladder without hydrating your cells. It's like trying to water a bone-dry plant by dumping a bucket on it. Most of the water runs off and the roots stay dry. But if you water slowly, steadily over time, the soil absorbs it and the plant gets what it needs. Your cells are the same. They need consistent, steady hydration, not massive amounts separated by dry spells. The third mistake that's spiking your blood sugar without you realizing it is drinking ice-cold water, especially first thing in the morning. Cold water feels refreshing, but it causes your blood vessels to constrict and tighten. When your vessels narrow, insulin can't circulate properly. It can't reach the cells that are waiting for it. Room temperature water or warm water keeps your vessels relaxed and open, so insulin can move freely and do its job. This matters most in the morning when your body is dealing with that overnight glucose release and before meals when your system is preparing to handle incoming carbohydrates. Here's the exact method that addresses all of this. And I need you to understand not just what to do, but why each piece works. Because when you understand the mechanism, you'll actually stick with it instead of giving up after a few days. The moment you wake up, before anything else, before coffee, before checking your phone, before getting out of bed, drink 1 full glass of warm water, about 12 ounces. And here's what makes this different from just drinking water. Add a tiny pinch of natural sea salt, just what fits on the tip of a butter knife, and squeeze in juice from half a lemon. After 8 hours of sleep, you're not just low on water, you've lost electrolytes, sodium, potassium, magnesium. These minerals are what actually help your cells absorb water instead of just letting it pass through. Without them, you can drink water all day and still be dehydrated at the cellular level. That pinch of sea salt provides those minerals in natural balanced form. Use natural unrefined sea salt or Himalayan pink salt, not table salt. Table salt has been chemically stripped of trace minerals. Natural salt still contains what your body needs. The lemon does something most people don't realize. It creates a slight acidity that stabilizes your body's blood sugar response to breakfast. When your system is properly hydrated and slightly acidic from the lemon, you don't spike as hard when you eat your first meal. Your blood sugar rises gently instead of shooting up. But there's something else this morning routine does that explains why it works so well for morning blood sugar specifically. This warm, salted lemon water calms your adrenal glands. These glands sit on top of your kidneys, and they produce cortisol every single morning. Cortisol is your natural wake-up hormone, but cortisol also signals your liver to dump stored glucose into your bloodstream. That's part of the reason morning blood sugar runs high even when you haven't eaten anything overnight. It's not just leftover from yesterday, it's your liver responding to cortisol. When you hydrate properly with minerals first thing in the morning, you signal your adrenals that everything is fine. There's no emergency. They can calm down. Less cortisol means less glucose released from your liver means lower morning numbers. Margaret is 66. She'd been waking up to blood sugar between 170 and 185 for over 2 years. Bedtime numbers were fine, usually 120 to 130, but every morning high. She tried eating protein before bed, didn't help. Tried adjusting her evening medication timing, still didn't help. Her doctor kept saying her overall management was good. Just keep doing what you're doing. But those morning numbers terrified her. She felt like she was starting every day already failing. She started drinking warm water with sea salt and lemon the moment she woke up, at least 20 minutes before her coffee. Nothing else changed. Same evening routine, same medication, same breakfast. 3 weeks later, her morning average had dropped to 148, same meter, same testing technique, just consistently lower. And she said the clarity she felt in the morning was completely different, less foggy, less confused. That lower number gave her confidence for the entire day instead of starting defeated. About 15 to 20 minutes before lunch and dinner, drink a smaller glass of water, just 1 cup. This timing does something specific for blood sugar control. It prepares your digestive system and gets enzymes ready, but more importantly, it slightly dilutes your stomach contents, which slows how fast carbohydrates get absorbed into your bloodstream. When carbs enter slowly instead of flooding in all at once, your insulin can actually keep up. Your blood sugar rises gently instead of spiking hard. Research shows this simple timing can reduce post-meal spikes by up to 20%. That's the difference between seeing 195 on your meter after a meal versus 165 after the exact same meal. If you walk, garden, do yard work, anything sustained for more than 20 minutes, drink water during the activity, not just after when you're already depleted. Small sips every 15 minutes, about half a cup. This keeps your blood volume stable and prevents the glucose fluctuations that happen when you're active and dehydrated. When you exercise while dehydrated, your body perceives it as stress and releases glucose as emergency fuel, even though you don't need it. But if you stay hydrated throughout the activity, your body stays calm and your blood sugar stays stable. Temperature matters more than most people realize. Room temperature or slightly warm water around 72 to 75 degrees, especially in the morning and before meals. You don't need a thermometer, just water that's been sitting out at room temperature or comfortable warm tap water. This keeps your blood vessels relaxed and open, which allows insulin to circulate freely through your entire system. Cold water isn't dangerous, but warm water is significantly more effective for blood sugar control. It's a small difference that compounds dramatically over weeks and months. Consistency is everything. Your body thrives on predictable rhythm. When you drink water at the same times every single day, your metabolic system regulates itself more efficiently. Morning water at the same time, pre-meal water at regular intervals. This consistency teaches your body the pattern, and it starts working with you instead of fighting you. Your liver learns when hydration is coming and stops triggering emergency glucose releases. Your cells become more efficient at absorbing nutrients. Your insulin sensitivity improves because your blood stays at optimal viscosity consistently instead of fluctuating between thick and thin. 1 hour before bed, drink one final glass of warm water with 200 to 300 milligrams of magnesium citrate or magnesium glycinate dissolved in it. You can find these at any pharmacy or health store. Magnesium is absolutely critical for insulin function. It helps insulin unlock your cells so glucose can actually get inside instead of being stuck outside banging on the door. The vast majority of people over 60 are deficient in magnesium without knowing it. Taking it before sleep serves two purposes. It relaxes your muscles for deeper, more restorative sleep, and it keeps your blood sugar significantly more stable throughout the entire night, which directly translates to better morning readings. How much water total should you drink? Take your body weight in pounds and divide by 2. That number in ounces is your daily baseline. So, if you weigh 160 lbs, you need 80 ounces, which is about 10 cups. If you exercise regularly or you're in warm weather, add 1 cup for every 20 minutes of activity or heat exposure. How do you know if you're drinking enough? Look at your urine. It should be pale yellow like lemonade, not completely clear, which means you're actually overhydrated and flushing out minerals you need, not dark yellow or amber, which signals dehydration. Pale yellow is the optimal target. Here's how to make this practical instead of overwhelming. Get a reusable water bottle that holds 24 ounces. Fill it completely 3 times during the day. Once in the morning, once at midday, once in the afternoon. That's 72 ounces total, which is perfect for most adults. Keep that bottle visible on your kitchen counter, on your work desk, in your car. You'll drink significantly more when you see it constantly than if you have to go get it from somewhere. What should you actually expect when you start this? What's realistic in terms of timeline? First week, you'll probably feel like you're living in the bathroom. This is completely normal and expected. Your body is adjusting to proper hydration levels after potentially being chronically dehydrated for months or even years. This frequent urination settles down significantly by week 2 as your system adapts. During that first week, you should start noticing your morning blood sugar beginning to stabilize. Maybe not dramatically lower immediately, but more consistent. Instead of swinging wildly between 160 and 190, you'll see it staying in a tighter range like 155 to 165. That consistency is the first real signal that this is working. By weeks 2 to 3, you should experience noticeably more stable energy throughout the entire day. Less of that frustrating afternoon energy crash where you feel like you desperately need a nap. Your post-meal blood sugar readings should become substantially more predictable. The same meals that used to give you wildly different results on different days should start producing similar numbers consistently. Your body is learning the rhythm and responding to it. By week 4, if you check your A1C, you might see it beginning to trend downward. Not necessarily a huge dramatic drop immediately, but clear, definite movement in the right direction. And what people tell me most consistently is they just feel genuinely better overall. More clear-headed, more energetic, more like their old self. They can't always explain it precisely in medical terms, but they absolutely know something fundamental has changed. Dorothy is 74. She'd been managing type 2 diabetes for 18 years. Multiple medications, careful carb counting, daily walking, everything her endocrinologist recommended. But her A1C had been steadily creeping upward over the past 3 years from 7.3 to 7.8 to 8.2. Her most recent test came back at 8.6. Her doctor was seriously discussing starting insulin therapy. Dorothy felt completely defeated. She'd been fighting this battle for nearly 2 decades and felt like she was losing ground despite doing absolutely everything right. Her water intake was terrible when someone actually asked her to track it, maybe 3 or 4 small glasses throughout an entire day. She never felt thirsty, and honestly, she hated using the bathroom frequently, especially when she was out with friends. Someone in her support group mentioned the hydration timing approach. She was deeply skeptical. Water seemed far too simple to actually matter for something as complex as diabetes. But she was desperate enough to try anything at that point. She started the full method. Morning water with salt and lemon before anything else. Pre-meal water, 15 minutes before eating. Consistent intake spread throughout the day using a visible water bottle. Magnesium water an hour before bed. The first week was genuinely annoying. She felt like she lived in the bathroom, but by week 2, that had settled down considerably and become manageable. 6 weeks later, her daily numbers had completely transformed. Her average used to hover around 190 to 210 throughout the day. Now she was consistently between 150 and 170. Her doctor actually reduced one of her medications because her control had improved so dramatically. But what struck Dorothy most powerfully wasn't just the numbers on her glucose meter. She had real energy again, sustained energy that lasted throughout the day. She could think clearly without that constant mental fog that had become her normal. She'd even started gardening again, something she'd completely given up on 2 years earlier because she just didn't have the physical or mental energy for it anymore. 3 months later, her A1C results came back at 7.4, down from 8.6. She cried when she saw that number. Happy tears. She said she genuinely believed she couldn't improve anymore at her age, that her body was just going to keep deteriorating year after year no matter what she did. But something as simple and inexpensive as water, timed correctly with the right additions, had given her hope again, real tangible hope backed up by actual measurable numbers. This is not a replacement for medical care. If you're currently taking diabetes medication, do not stop taking it. If your doctor has you following a specific management plan, continue following it faithfully. What proper strategic hydration does is support everything else you're already doing. It makes your medications work more efficiently within your body. It helps your body function closer to the way it's actually designed to function. I've seen people who stuck with this consistently for 2 or 3 months eventually reduce medication dosages under their doctor's careful supervision. Not because water replaced medicine, but because their entire metabolic system started functioning more optimally and needed less pharmaceutical support. If you have any degree of kidney disease or kidney problems, talk directly with your doctor before significantly increasing your water intake. For most people, this approach is completely safe and highly beneficial. But if your kidneys aren't filtering properly, you need individualized professional guidance on fluid intake. If you're taking blood pressure medication, pay careful attention as you increase hydration. Proper hydration can naturally lower blood pressure, which is genuinely beneficial, but it might require medication dosage adjustments. If you experience any dizziness or unusual symptoms, contact your doctor immediately. I want to challenge you personally to try this approach for 14 days, just 2 weeks. Follow the method exactly as I've outlined it. Morning water with sea salt and lemon before anything else touches your lips. Water 15 to 20 minutes before lunch and dinner. Proper daily water intake spread consistently throughout the day. Magnesium water 1 hour before bed. Track your blood sugar carefully during those 2 weeks. Write down the numbers. See if they become more consistent. See if your morning readings stabilize. See if post-meal spikes become more predictable. Pay genuine attention to how you feel beyond just the numbers. Energy levels throughout the day, mental clarity and focus, sleep quality at night, overall sense of well-being. Sometimes the subjective improvements are even more meaningful than the objective meter readings, though both matter. If after 2 weeks you observe real measurable improvement, keep going. Make this your permanent new normal. This isn't a temporary fix or a short-term experiment. This is about giving your body the foundational support it needs to function properly for the rest of your life. And please come back to this video and leave a comment telling me what you noticed, what changed for you, what surprised you. Your personal experience and story might be exactly what another person desperately needs to hear to give this method a serious, committed try. If you made it all the way to the end of this video, type "I watched till the end" in the comments below. It genuinely helps me understand that this information is reaching people who truly need it, and it helps YouTube's algorithm share this vital information with more people who are struggling with blood sugar management. Then tell me, are you going to try this method? What's your biggest personal challenge with staying properly hydrated? Share your thoughts honestly. I read every single comment. If this information was genuinely helpful to you, please share it with someone in your life who's struggling with their blood sugar. A parent, a spouse, a close friend who could benefit from this simple, practical strategy. And if you haven't already, hit that subscribe button and turn on notifications so you never miss future videos on managing blood sugar, improving metabolic health, and living well with diabetes. Thank you for being here and for taking your health seriously enough to watch a 15-minute video all the way through. That commitment matters. Small strategic changes implemented consistently over time create genuinely measurable results.